The public comment period ended earlier this week for a Biden administration proposal that could force doctors to perform gender transition surgeries and abortions. The Health and Human Services proposal would add sexual orientation and gender identity along with pro-abortion language to the existing protections against discrimination on the basis of sex. The measure reverses former President Donald Trump's efforts to strengthen conscious protections for medical professionals. And we go now to Dr. Stephen White, president of the Catholic Healthcare Leadership Association. Dr. White, thank you so much for your time. We really appreciate it. Can you talk to us more about this proposal and your concerns for Catholic medical professionals and others?
Yes, thank you, Tracy. As you mentioned, this new rule is promoted or proposed by the Health and Human Services Committee, and it addresses sections 1557 of the Affordable Care Act, which covers prohibition against discrimination in federally financed healthcare programs. And the danger here is that the rule as it's currently proposed would impose upon those of us of faith who oppose abortion and who oppose trans-affirming therapies, particularly in children and adolescents, it would deny us our religious liberty and our medical conscience protections rights not to perform or participate, or for that matter, pay for these procedures. So it's a serious affront to our constitutional right to religious liberty and medical rights of conscience.
And what type of impact do you think it could have on Catholic healthcare systems, and in what ways?
Well, it would be devastating. First of all, we'd be subject to exclusion from all federally financed medical programs. So Medicare, Medicaid, children's health insurance, the state exchanges and the Affordable Care Act. It would be a financially devastating blow to medical facilities and medical practitioners. Secondly, it would force us or try to force us to participate in these medically unnecessary, medically harmful, and ethically ethical procedures that we oppose. And so what would happen is we're going to have to conscientiously object, and then we would be subject not only to those financial penalties, but potentially civil and criminal liability if we refuse to participate. So this is very serious and something that people need to be aware of and oppose along with us.
Yeah, certainly. And we know the public comments period ended just a couple of days ago. What comes next?
Well, now we're in a waiting period. I'm glad to say that the Catholic Healthcare Leadership Alliance, along with its partners, have submitted multiple very detailed comments opposing this rule. And while I'm not optimistic that the rule will be abandoned, because I think it's very clear that this administration is going to move forward with these types of mandates for these types of procedures, if the rule is actually promulgated as it is currently written, this is going to be another legal battle similar to the legal battles we had with the Obama administration's contraceptive mandate and their own transgender mandate. So it'll all end up in courts, and it'll be a huge mess.
Yeah. One thing I'm curious about is how this may have an impact on the future of medicine and maybe those thinking about going into medicine and doctors as well.
Well, that's a good question. Obviously, it would affect us adversely. But, Tracy, we believe that in Catholic healthcare, we're guided by the Holy Spirit. And one of the goals of the Catholic Healthcare Leadership Alliance, which has truly been an inspiration of the Holy Spirit, is to create a vision for the future of healthcare, not only for Catholics, but for all people of faith and for all people who are interested in the highest quality of medical care based on the fundamental ethics that are contained even within the Hippocratic Oath, which has guided healthcare for 2 millennia. So while this is a difficult time and this is going to be a difficult challenge, we're certain that we will prevail, and we have to remain in the fight because this is about the right to life, the right to freedom, the right to medical rights of conscience, and we have to fight for those things. So we encourage everybody to join us, and we'll see where we lead, but we're not giving up this fight.
Before I let you go, we don't have a whole lot of time left, but I want to talk about an event that you're hosting next month at Catholic University. What can you tell us about that?
Yeah, that's the Symposium for the Advancement of Catholic Healthcare. And as I suggested, we want to bring together all of the leaders in healthcare, and Catholic healthcare in particular, to create a new vision and a renewal of Catholic healthcare. It's been very challenging over the last several decades to uphold our right to practice medicine in accord with our faith and our consciences. But the CHCLA will host this symposium with Catholic University of America, and we're going to bring together experts to discuss these issues. And it's the launch of a 3-year program. And we're going to have seminars and symposia like this throughout the year for the next 3 years to address all aspects of healthcare so that this new vision can be implemented and promoted for the common good.
Well, Dr. White, thank you so much for your time today and being with us. We really appreciate it. God bless you.
Thank you, Tracy. God bless you too.